Hello and very welcome. My name is Kai-Lun Liao. I'm the presenter as well as the first author. I'm a PhD student from Xi'an Jiaotong-Liverpool University in China and University of Liverpool in UK. I will be presenting through the research under the title of Focus-Driven Augmented Feedback, enhancing focus and maintaining engagement in the upper limb virtual reality rehabilitation. Along with me, we have the co-author of Mengjie Huang, Jiajia, Chen, and Yang. The contents of today's presentation includes the introduction to the project, related works in the relevant fields, the methodology and the results of the research, and lastly, the discussions and limitations and future works. First of all, let's start with the introduction. Well, virtual reality has progressively become a transformative tool in the field of rehabilitation, and many studies found that maintaining patient focus and engagement during rehabilitation is fundamentally linked to improved recovery outcomes. But there are some gaps in the current fields. First, measure focus and engagement in rehabilitation, especially in VR, is a big challenge, and we have limited methods to sustain or enhance focus rate and engagement during rehabilitation sessions. We also lack of dynamic mechanism in VR for real-time data collection and adaptive feedbacks. Therefore, this study aims to solve these gaps by introducing the Focus-Driven Augmented Feedback system, which is a VR system that uses real-time eye tracking to dynamically adjust visual feedback based on patients' focus rate. The aim is to enhance focus and maintain engagement during an upper limb rehabilitation exercise in VR. The research question is, how does integrating real-time eye tracking into VR rehabilitation games affect focus and engagement during upper limb rehabilitation? And the study has three significant contributions. First, it provides a novel insight in how real-time biofeedback can be used to customize game mechanics. It also provides a method to sustain user focus during rehabilitation. And lastly, demonstrate the potential of FDAF system to advance VR therapy. Next, let's go through the related works. VR can enhance motivation by embedding gamified elements, and it can provide safe and controllable settings with lower risk and injuries. It also allows customizations of programs, for example, different settings, change of difficulties according to the patient's abilities, and have different kinds of exercises. Overall, in long term, it is much lower cost and it embeds very well in collecting physiological signals with sensors and softwares. Attractive elements, such as augmented feedback, gamified features, growth and progression, can increase patients' focus. And with that, we can further increase motivation and engagement. However, currently measuring focus rate is challenging because traditional methods are ineffective. They are not in real time and fails to capture immediate fluctuations, but the introduction of eye tracking technology might solve the problem. Lastly, augmented feedback gives additional cues to support the body's natural sense of feedback. It can be either visual, auditory, haptic, or reward-based. Augmented feedback can maintain a patient's positive mindset by reducing negative feedback and letting patients to be more confident and believe in their own capabilities. It also has the ability to help brain to rewire pathways, which will improve functional recovery. And let's go through the methodology. The FDAF system works by providing a positive feedback loop, which in the rehabilitation game will monitor patients' eye movement and analyze the exact gaze point on what they are looking at. We want them to be focusing on important elements such as the limb that they are training on or the target that they are trying to reach. In our case, it will be the golden coins. If they are focused, we reward them in augmented feedback, which will let the patient feel that they are doing better than expected, and this will help them to reinforce the idea of being focused will have better performance, and this will result in an enhanced and maintained focus rate. The FDAF system provides a visual augmented feedback, and here is an example of how 50% augmented feedback works. For example, if your arm is 10 cm away from the coin, the augmented feedback will place your arm 50% closer at 5 cm, making you feel that it is closer. As your arm moves closer, for example 5 cm away from the coin, the ratio of the augmented feedback is the same, 50%, so your arm will be placed at 2.5 cm away from the coin. This means that as your arm is closer to the target, the effect of augmented feedback will reduce. In other words, the FDAF system do not change the difficulty of the rehabilitation task. It only makes you feel that further distance is easier and push you to put in the efforts to complete the task. And when the distance is close to the target, even without augmented feedback, you are likely to put in the last little effort to complete the task. The rehabilitation movement we work on is called horizontal adduction and abduction, which is basically moving your arm horizontally left and right. And based on that rehabilitation move, the rehabilitation game implemented requires patients to grab on the little car and move their arm horizontally to collect the coins. We have conducted 3 user experiments, where user study 1 focused on testing the functionality and potential of the FDAF system. 35 healthy participants did this first user study, and we collected measures on focus rate, performance, and usability. We tested a wider range of augmented levels from 0% to 75% with an incrementation of 25%. Each participant placed the rehabilitation game for 1 minute on each augmented levels. From the feedbacks, we improved the system, for example, switching the heavy Vive controller to a much lighter Vive tracker. In user study 2, we have another 36 healthy participants, and we added additional measures including sense of agency and engagement. From the previous study, we found that 75 augmented level isn't giving a good result, and we narrowed down the scope to 0% to 50%, and this time with an incrementation of 10%. User study 3 is the same as user study 2, but with 17 real patients. We introduced a new subjective measure called professional observations, which allows the therapist to compare the FDAF system with traditional rehabilitation. And next, let's go through the results. First, focus rate is the measure of time focused on important elements against the total time played. From the result of user study 1, we found that the highest focus rate is at 25% augmented level, and 75% augmented level isn't giving a good result. So we narrowed down the scope and focused between 0 to 50%. This time we found that the optimal focus rate is at 30% augmented level for healthy participants. However, it is a bit different for real patients in user study 3. For patients, 20% augmented level has the best result in focus rate. Performance is measured by the ratio of coins collected against the total coins, using the coordinates of real limbs and coins. And from the result, we see that as the higher the augmented level, the higher the performance, meaning that the FDAF system motivates the participants to put in more efforts to complete the tasks. Next, let's go through the sense of agency and engagement together, since they appear similar patterns. Sense of agency is how natural it feels when controlling the car, and engagement is measured using the Hopkins Rehabilitation Engagement Rating Scale. For healthy participants, we see that until 30% augmented level it is all acceptable, but for real patients it is lower at 20% augmented level. This might be because patients are more sensitive in their limbs. Additionally, the result also shows that the higher the augmented level, the more you feel the unnatural of the control, and more likely to notice the support from the system and decrease engagement. Next, the usability is measured using System Usability Scale, and all results shows that it is an excellent system. From the observation of the therapist, although there is no short-term improvement in patients' strength and range of motion, but they appear to be more joyful and engaged, and this could positively influence the outcomes. Lastly, let's go through some discussions and conclude the presentation. For the result, FDAF system shows its ability in enhancing focus rate, and it can dynamically adjust the feedback based on focus rate, which overall can motivate patients to put in more efforts to complete rehabilitation tasks. With the experiment, we also found a balance point, increasing focus while maintaining engagement, and it is 30% augmented level for healthy participants and 20% augmented level for patients. This presents the FDA system's flexibility for long-term rehabilitation and shows its advance of hardware device in rehabilitation. But there are some limitations. First, the FDF system will be less effective when patients can now observe on the body part, for example when doing lower limb trainings. There's also the hardware limitations, where some patients, especially the elder ones, feels neck strain and eye fatigue when using VR. And for future work, we like to focus on expanding sample size and conducting long-term experiments to help optimize the FDAF design. And this is the end of the presentation. Thank you very much for watching.